So as a doctor, whenever I have trouble sleeping, like if I'm in a hotel or an Airbnb and I don't have my normal pillow, or I just have a lot on my mind and I can't seem to get comfortable, I always think back to a specific experience from my residency. There was one rotation we did that was an overnight rotation at the VA. Essentially, we would take care of all the general medicine patients that had been admitted to the hospital between 6 p.m. and 6 a.m. It was actually a pretty popular rotation because the VA hospital wasn't that busy compared to the university hospital. This meant that it wouldn't be unusual for you to have time to sleep for 1, 2, even 3 hours in a given shift in between the patient care that you were performing. But the catch was that the only place to sleep was the VA call rooms. And call room is a generous term because basically they were minimally modified old patient rooms. So there was still the oxygen hookups, the old vacuum suction canisters, and the bed was basically just an old patient bed that had been decommissioned for this purpose. VA hospitals also just have a creepy vibe, but this one was built in whatever the creepiest decade of architecture was, and these rooms were on the top floor of the hospital and probably haunted. So needless to say, it was not easy to sleep in them, and I'm very germophobic despite being a GI doctor, so I would just lay on my back with my hands folded across my chest so I wouldn't risk getting my face any closer to the pillow or sheets than I had to. This basically allowed me to minimize my skin contacting the bed. I didn't even take off my shoes sometimes, and despite having the responsibility of taking care of multiple patients at the same time and the risk that if a patient's heart would stop, I would have to wake up from a dead sleep to go try to restart their heart, I managed to sleep most nights on this rotation. So if I'm struggling to sleep, I just think back to those nights. If you can sleep in that circumstance, you can sleep anywhere.